Introduction to our session today. Hi, I'm Emily Lubring, and I'm the Director for the Federal Programs Unit with the Division of Developmental Disabilities. And I want to thank you for joining us today for an overview of the Division's Valued-Based Payment Incentives plan for upcoming incentives. Today, we're going to talk about, give you a timeline of our milestones for the valued-based incentives. And then we'll go into the budget and the value from the value-based payments. And then we'll go into the division's vision for valued-based payments and how that fits in with the bigger picture for the division and the developmental disabilities. And lastly, we will provide an overview, more detailed overview of each of our 9 incentives that we are proposing that CMS approved for supplemental or enhanced payments for our services. So with that, I'm going to hand it over to Angie Brunner, our Deputy Director for our division, and she will start with an overview of the milestones for our timeline.
Thank you, Emily. Again, yes, I'm Angie Brenner. I am the Division Deputy Models in conjunction with the Center for Medicare and Medicaid Services, or CMS, as well as the Office of the National Coordinator for Health IT. We refer to them as ONC. What you see here on this slide is a quick snapshot of our most current key value-based payment milestones over the last few years, and then kind of what we're going to be working on the upcoming year. We have worked on developing a use case with our providers to test data exchange. We have mapped our Missouri Individual Support Plan to the Electronic Long-Term Services and Support Standards. Those are national standards for data components. We've submitted waiver renewals to capture more employment data. We've contracted with FEI as our online case management system. In September of 2020, we were awarded the LEAP grant. With the LEAP grant, we performed a mid-year demonstration at the HL7 Connect-a-thon. And really what that means, it's basically an opportunity where Missouri as a state, we tested our use case with our LEAP grant work group to make sure that that data flow could occur from the case manager to the waiver provider to the medical provider and then back again through all entities. Our test was successful with some lessons learned, and those are of course on our value-based payment webpage. Following that, learning a lot. Following that, our General Assembly approved the division's budget to include value-based payment initiatives, including data integration. The division right now is working with CMS to submit value-based payment waiver amendments to implement these value-based payment initiatives effective January 1st. After approval and after the initial implementation of those, the division will continue to work with stakeholders to analyze that data and develop value-based payment measures for future implementation. We also have here a link to our work in progress value-based purchasing webpage. We're going to continue to update that as we move forward, but that has started. So when you receive this presentation, you'll have the link for that. Let's go to the next slide. So we're going to talk a little bit about the background and the perspective of the fiscal year 23 budget, and with that, we're going to share with you what we like to call our hexagon flowers. So here we go. On this slide, you can see 2 hexagon flowers. The first flower represents our current state. The second one represents our future state. Now that we have our budget implemented, this is what we're going to be working towards. And that future state is really that the way we need to move to get to value-based care models and value-based payments. Anywhere on here that you see green, that means we've implemented it. Orange means it's in progress, and green and red means that it's not implemented yet. So if you look at the left-hand side, we currently have 2 areas that we are doing that are green. Those are acuity-based payments and value-based payment planning and research. So again, like I said previously, we've been in that planning and research stage for several years now, through technical assistance with CMS, through ONC, and through our LEAP grant. Many of our stakeholders have been hearing about this, this research and this planning and have been a part of it. So we really thank everyone for that. You can also see in the current hexagon flower that we have baseline wages and stable workforce as an effort that's in red. So prior to the most recently approved budget, many of our rates were historically negotiated rates, rates that were implemented in the early 90s with just COLAs applied to them. The budget that was just passed by the General Assembly includes rate increases to get those HCBS provider rates as with a standard direct support professional of $15 an hour. So we are really excited about being able to standardize those rates and implement that baseline wage. We have already moved to historically negotiated rates to standard rates in our residential services, and you can see that in that next hexagon petal, which is orange. And then the last two petals in orange are data for outcomes and performance, as well as IT infrastructure. Those are areas that we began researching. We're still learning and developing those. We've been doing that since at least 2018. I think that those are two areas that you're always going to see in orange, because those are things that are going to continually improve and we're going to continually work on. So again, with the signed budget by the governor, you can see our future hexagon shifting closer to that modernized value-based care model, that value-based purchasing structure and system. So today, that's what we're going to talk to you a little bit more about, is just really that shift in our system. And so I'm going to pass this along to Dwayne so he can talk big picture with you. Thank you.
Good morning, everybody. My name is Dwayne Shoemate, and I'm the Coordinator of Employment and Community Engagement for the Division of DD. And I'll be speaking with you a little bit this morning about the big picture. As we go to the next slide, Angie had talked about the hexagon flower and each of the petals. And I know as we talk about value-based payments and we talk about a lot of the high-level system stuff, what's easy to get lost is what does this mean at the implementation level? And so really what we are talking about is value-based care. Ultimately, we kind of have bucketed all of our activities into three areas. The first being, what can we do to really enhance and expand individuals in improving and experiencing increased outcomes? The second really is, how do we go about rewarding those provider agencies, those individuals in a person's life who really help facilitate the quality outcomes? And then on the third aspect of value-based care is how we can continue to be good public stewards of the tax dollars that we're spending. So as we move on to the next slide, you can see those three big items around improving outcomes, looking at rewarding for those who are facilitating quality outcomes, and great public stewards as kind of our three broad bucket areas. What you'll hear today about some of the value-based incentives are focused around each of these three areas. So around improving individual outcomes, you will hear a little bit about the health risk screening tool and how looking at health outcomes continues to help individuals improve their quality of life and be able to actualize other outcomes in the community. Other things like tiered supports will be discussed. And again, the value of tiered supports is that it does enable individuals to always be optimizing at their or functioning at their optimal levels to be able to be socially and community, to have more social community inclusion. We'll talk a little bit about remote supports that also touch on that social and community inclusion. And then we will talk a little bit about, in the facilitating quality outcomes, the things that we're doing to incentivize providers to have a good skilled workforce. And having a skilled workforce is one aspect of being able to deliver quality outcomes. But if you don't have adequate cash flow, and if you don't have that workforce that remains in place and stable, it's difficult to facilitate those individual quality outcomes. So we will be talking about incentive payments that will focus on increasing the skills of the workforce, stabilizing the workforce, and creating cash flow. And then in the third area around being great public stewards, we'll talk some about the EVV incentive payment and how that EVV helps us ensure that we're spending dollars appropriately and how it enables us to continue to be successful in looking at new and different initiatives. So we do have additional items listed on here. Some of these are other areas of effort that we have. Some are other areas of budget focus. But today, as we focus just on our value-based payment incentives, the remainder of the presentation will be on that. And with that, I will turn it back over to Emily.
Thanks, Dwayne. So not too far. Okay, so now we're going to start into the detailed explanations of our 9 incentives that we're proposing for approval by CMS. We have just kind of quick overview of the 9 that we'll have is the health risk screening tool, which is also the HRST short, and then the NCI Staff Stability Survey has an incentive. We have a tiered supports incentive. We have an employment reporting and a apprenticeship incentive. We also have a DSP training incentive, and then a remote supports cost savings incentive, and lastly, an EVB incentive. So now I'm going to start with sharing with everyone today about the HRST, or the Health Risk Screening Tool. Who is this incentive for? It's for DMH-DD waiver residential service providers and TCM providers serving individuals receiving HCBS waiver services. The provider may receive a one-time payment calculated at $72.20 for the completion of each individual initial health risk screening tool during the identified time frame. When is this effective? Payments will start beginning January 1st, 2023 for state fiscal year 2023. And you'll see as we go through each of these incentives that each one is planning to be implemented on January 1st for the state fiscal year 2023. So why is this incentive important? The incentive to incentivize applicable providers to initiate the HRST screening process prior to the current targeted statewide implementation of May of 2023. So we're wanting to have all of our individuals to have that initial HRST assessment completed by May of 2023. The HRST is a tool used to provide early detection for health risk and destabilization. The completion of the HRST will align with the individual's annual individual support plan meeting, and the HRST information will support the team with identification of implementation strategies to mitigate risk and improve health outcomes for our individuals. Information is entered electronically into the HRST system and will be accessible electronically to all identified team members, providing a more efficient and effective system for interdisciplinary team members' communication and direct accessibility to your identified health risk planning and service information. It's more efficient and effective process for ongoing monitoring of our individuals' health and welfare. The HRST will, and so to explain how, the HRST will be completed in the intellectability system. The data indicating HRST completion by the provider will be pulled quarterly by the division for processing and payment for the initial HRST assessments completed in that quarter. Now I'm going to turn it over to Dwayne to tell us a little more about tiered supports.
Thank you, Emily. So normally Lucas Evans or someone from our behavior analyst team presents on this initiative, but as they have another meeting today, I've graciously agreed to provide the review of this. So for our tiered supports, it is the second of the 9 incentive payments that we're talking about today. This particular incentive that we've designed, the intention would be that it's available for service providers who deliver individualized supported living services. So there's actually two payments associated with this particular area. One is the monthly payment of $174, and that's just to share data elements identified in the provider contract. Again, that would be reports that would be completed each month on basic data elements related to tiered supports, and that payment would be $174. There would also be a second incentive payment, which is a quarterly payment, and that is really looking at how the implementation strategies have been delivered over the period of the quarter. And that particular payment would range from 40 to 100% of the maximum incentive payment. And on a future slide, you will see exactly that kind of broken out. Again, like the other payments, this one would start on January 1st of 2023. So as we move on to the next slide, the main reason that we would be looking at doing this particular incentive is to really incentivize providers to continue to develop and maintain universal systems and support that really help improve individuals' quality of life. It also results in fewer risk outcomes, and also through research has also been demonstrated to reduce staff turnover. So ultimately, these reports will be uploaded through a web-based platform for both the monthly payment as well as the quarterly evaluation payment. And as we move on to the next slide. So again, as an example, with the incentive payments, just for sharing data, that is one of the two incentive payments. Just for sharing data, that would be $174 a month, or the equivalent to $522 a quarter. When we look at the implementation, which would be a second incentive payment, the provider could be eligible for the $174 a month payment. Plus, at low implementation, they'd be getting $6,018 for the quarterly report, for a total of $6,540. If a provider is implementing at the moderate level, you can see that that would equate to a $10,532 quarterly report. When added to each of the monthly reports, would be a total of $11,054 for the quarter. And then for those ISL agencies that are performing at the high implementation, they would be eligible for the $174 a month for basic reporting, and then the $15,045 as a high implementer, resulting in a total of $15,560. So as we go on to the next slide, this is the tool that would be used to assess the implementation levels. And again, this is a tool that has been available currently on our website. So as we move on to the next slide, I will pass it over to Wanda Crocker.
Thank you, Dwayne. So this next part of the value-based payment presentation is about remote supports. Remote supports, the WHO is any individualized supported living and in-home respite service provider who has transitioned or will transition from paid staff supports to remote supports, resulting in an overall reduction in budget due to reduced staffing hours. What is the value-based payment? It is 15% of the state's share of savings for each 6-month period. And our current state share is 33.99%. Who can receive the payment? It's any individualized supported living and in-home respite service provider who has or will transition from paid staff supports to remote supports, resulting in an overall reduction in the individual's budget due to reduced staffing. Oh, I'm sorry, I just read the same slide again. Apologies.
Wanda, you had me a little confused.
I
Maybe
have
you wanted me to go back.
No, don't go back. I have notes too, so I'm looking at 2 slide decks. So, oh my goodness. So when payments are to start beginning January 1st of 2023 for state fiscal year 2023. So that means on January 1st, we'll be evaluating savings incurred from July 1 of 2022 through December 31st of 2022. Why are we looking at this value-based payment? We're looking to increase independence of individuals. We have success story upon success story for the over 250 individuals currently receiving remote supports who have proven that this works, even in the face when other people said it couldn't. It reduces the stress level of overall DSP workforce, allows providers to utilize those staff where they need them most and when the individual needs them most, instead of using them for general oversight on, say, overnight shifts. And of course, why? As we've seen since we started remote support since 2012, remote support creates savings to the states. It does beautiful things for the individual. It creates career paths and positive changes for the provider, and subsequently that results in a savings to the budget. So how are we going to calculate the value-based payment? The savings is calculated monthly for the previous 6-month period, and the provider may earn a quality payment up to twice a year. Now we'll both go to the next slide. So how are we going to do this? So when you're looking at the calculations, it gets a little tricky. There's a lot of numbers involved here, and we'll do a numerical representation in a moment. The savings is calculated monthly for the previous 6-month calendar period. Provider may earn the quality payment up to twice a year. So the way that the calculations break down, we have to look back to the month prior to remote support implementation. So for some people, that could go back to 2012. So we have to go all the way back to when remote support was initiated and look at the month prior to determine how many hours they were being supported with in-person staff prior to remote support. And we're going to take that dollar amount at the current, meaning fiscal year 23, reimbursement rate. And then we're going to subtract from that monthly amount how much the individualized supported living or respite at the current rate cost, and then subtract any monthly authorized amounts being used for the remote support components such as the lease, the monthly service agreement, and the actual response staff. If a provider submits an invoice during the first 6-month period for an individual, they will remain eligible to submit an invoice during the second 6-month period for the same person, so long as a remote support savings is realized. Next slide. A little bit more into the how, into the details, because we are talking to services, and I just kind of explained how the services for ISL work. But we did have a question about, well, what if we're implementing remote supports and individualized supported living at the same time? Therefore, they didn't have a previous ISL budget. And so in that situation, the savings would be based on the individual share of 24 hours a day of individualized supported living at the current unit rate of reimbursement, less the actual budget being implemented during the remote supports, less all the remote supports components. The other how gets a little more technical, because you might be wondering, well, with respite, they don't necessarily use respite every month. They don't necessarily have a monthly budget. So how are we going to look at that? So if remote support is implemented, resulting in a decreased use of respite, the savings per month will be looking at the average number of respite hours per month the individual used in their previous ISP year. At the current rate, less the cost of remote supports per month. So it'd be a little bit different because it's a different type of service. So now I wanted to show you, for me, things work better in numbers. And so we shared a lot of words. And so hopefully that will, the numbers will break it down and make more sense. So the first line is the ISL budget prior to remote supports. We have to go back and find out how much were we paying for the service prior to implementation. So I took an example of a person who started remote supports in fiscal year 18, who had a floor rate back then of $17.50 an hour. So in 2018, for this person, we were paying $12,775 a month. So now I've got to convert that. What would that cost me today? Well, today in FY '23, this same individual standard rate is $36.31 an hour. So today we would be paying $26,506.30 for the same number of hours implemented prior to remote support. So that's the dollar amount we're going to use to calculate our savings at $26,506.30. And then we're going to look, so what is on their ISL budget with remote supports now? And it's right now that staffing pattern is 486.67 hours at the current 36.31. So it's 17,670 and 99 cents. How much are we paying for the remote supports response center? We're paying 1,689.60 a month. And then how much are we paying for the technology each month? And that fee would be $750. So when I take the ISL budget prior to remote supports, less the current ISL budget, less remote support center, less technology, the total savings per month is $6,395.71. So the state share of that, being the 33.99, is $2,173.90. So the provider is going to get 15% of that, which is $326.09. That nets a 6-month payment of $1,956.51. Wanted to give you an example, because kind of gotten these questions. A person is receiving ISL services in January of 2023 and implements remote supports in March of 2023. The months of March, April, May, and June would each be evaluated independently for their savings, as the ISL budget could change monthly, resulting in more or less savings. So we'll look at each month savings, and they don't have to have been participating for the entire 6 months. At what month did the savings start? Similarly, a person could have ISL and remote supports in place in January and discontinue the remote supports on March 30th, reinstating their full ISL budget. The provider would be eligible for savings from January through March when remote support was in place, but not eligible from April to June as no savings was incurred. So that is the end of our remote supports component. Hopefully that helped people understand it. And I'm going to turn it over to our next presenter.
All right, I have made it off mute, and I think my camera is working as well. So I am Heike Johns, Director of Communication and Organizational Learning for the division, and I am here to talk to you about DSP training levels. So who is this for? What does it apply to? Any waiver service, non-licensed professional staff delivering contracted HCB services, and those services included are listed there on your screen. So again, as mentioned earlier, this presentation will be posted along with the recording. So that will give you an opportunity to go back and take a look at the list and me not read through all of those to you. So what is it? It's a payment of 1% over the Medicaid paid applicable service claims when 90% of eligible DSP workforce has completed level 1 DSP training and has 6 months tenure with the same agency. I know folks have asked, is that full-time, part-time? That is all DSPs. We're not looking to see how many hours a week they're working. So that's the eligible DSP workforce. And then, as mentioned, they have to be with the same agency for 6 months. Then there's another 1% payment over the Medicaid paid applicable service claims when 50% of those eligible DSP workforce folks have completed DSP level training 2 and have a minimum of 6 months tenure with the same agency. And then there's another payment of 1% over the rate, the Medicaid paid applicable service claims when 50% of eligible DSP have completed level 3 and have a minimum of 1 year tenure. So recap, that's 1% for level 1, it's 90%, 6 months tenure. Another 1%, so now we're up to 2, for 50% of the eligible eligible workforce and 6 months tenure, and then another 1%, which takes us up to 3%, for when 50% of the eligible workforce has completed DSP level training 3 and has a minimum of 1 year tenure with the same agency. So, and that a provider may earn that quality payment twice a year. And when payments will start, January 1st, 2023 for fiscal year 2023. Why? Increased staff retention. You can find, and a little exaggeration, 1 million different studies showing staff retention tied to training. So those are all out there and at your fingertips. Employees gain national best practice skills, mitigation of risk, and improved individual outcomes. So we're looking at ensuring that we're making good investment in those folks that are providing that direct care. And how? The training path, those training levels will be able to be accessed through our learning management system that's powered by Relias. That is available for free on our website through our MODD content portal. Also, for providers that may have their own Relias subportal under ours, that training plan will be available in their subportal as well. So 2 options. If you're contracted for a subportal, you'll have it at your fingertips. If not, you will have that for free, getting it through our MODD content portal. So, and with that, I believe that Dwayne is the next presenter with the Registered Apprenticeship.
Thank you, Heike. So our next incentive payment that we'd be looking at is one affiliated with the Certified Direct Support Professional Registered Apprenticeship. This would be eligible for any contracted provider who is participating in the Registered Apprenticeship program. So what that means is that the provider would have needed to have had an orientation visit with me, that they have been formally registered with the U.S. Department of Labor, Office of Apprenticeship, and actively recruiting and hiring individuals as part of that apprenticeship program. For those providers who are doing that, they would be eligible for a one payment of $1,560 that would be payable once the apprentice has completed 50% of the total curriculum, and then a second payment of $1,560 once the individual employee apprentice has fully completed the program and been issued the certificate as a certified direct support professional. This incentive would start on January 1st, similar to the other incentives. As we move on to the next slide, the reason for doing this is that there is research to indicate that by employers participating in an apprenticeship program, that it does create a talent pipeline of new employees from other workforce entities and workforce partners. There's also evidence that show that employees who go through a registered apprenticeship program have an overall increase in implementation of national best practices, which will result in mitigating risks of individuals and improving individual outcomes. And so this particular incentive would be accessed again by those provider agencies completing and uploading information into the U.S. Department of Labor's RAPIDS database, and then they would be submitting completion of that progress in a third database, web-based site, REDCap. We will be having an apprenticeship coordinator who will be validating the content that's been uploaded in the RAPIDS database, and they would be the individual that would be determining whether or not those requirements have been met. One caveat to this particular incentive is that to be eligible for this, the new employee apprentice must be a new workforce member. And what that means is that they were not previously employed by the contracted provider within the 6 months prior to enrollment in the apprenticeship program. So again, this is for new talent. Incumbent employees can participate in the registered apprenticeship program, but as far as this particular incentive payment, it would only be for those new employees that begin at any point in time with the provider, as long as they were not previously on that provider's payroll in the most recent 6-month period. So as we move on to the next incentive, It is the employment pay for reporting incentive. In Cat, if you, or Emily, if you can go back one, thank you. With this one, this would be eligible for any Division of Developmental Disabilities, HCBS contracted employment service provider. So this is a $55 payment for each quarterly episode of reporting. So for each of the employment definitions, whether that's career planning, benefits planning, pre-vocational, job development, or support employment, each quarter, the provider simply needs to complete the report. And as long as that report has been completed thoroughly and submitted successfully, they would receive a payment of $55. And this would also begin on January 1st of 2023. So as we look at the next slide, the reason that we are doing this is that we are wanting to incentivize providers to share with us data on the activities that they're completing as part of each of the employment service definitions and a variety of data metrics. That data will help us be able to redevelop this eventually into different outcome payments and incentive payments. So that's why we're wanting to collect the data, is so we can begin to look at actual start dates, end dates, and activities that have been completed. And this also will be submitted through a web-based portal through RepCap, where providers would complete that, and then that would be the mechanism for issuing the. And with that, I will turn it over to Emily.
Thanks, Dwayne. I'm going to finish up with our last two incentives. The first one being the NCI, or the National Core Indicator Staff Stability Survey. This, and who is this incentive for? It's for DMHDD contracted HCBS waiver service providers of residential, in-home, and non-residential services. What is the incentive? The incentive is the provider may receive a $2,000 payment for the completion of the NCI Staff Stability Survey. And again, the win on the incentive is beginning January. Implementation will be January 1st of 2023. The survey completion timeline for this survey cycle will be January 1st, 2023 through April 30th, 2023. The payment will require the agency completing the survey to enter information pertaining the staff tenure, retention, turnover, and vacancy within the service survey. And why is this incentive important? To incentivize applicable providers to complete annual and subsequent NCI staff stability surveys. The National Core Indicators Staff Survey collects information on the direct support professional workforce in Missouri, including information on the staff wages, retention, and turnover. The survey data supports the division's policy and program development to enhance the retention efforts and training needs of the DSP workforce. Survey will be provided to the division by the Human Services Research Institute. So NCI will provide us the data of those providers who have completed that survey, and that will be the information or the data we will use to determine paying the incentives. And it says annually, will be processed annually for that payment. And then lastly, our incentive for the electronic visit verification, or our EVV. If you're familiar with the EVV systems, this is the electronic visit verification for our agency and SDS PA, or personal assistant services. It's required by CMS through the CARES Act. And then MoHealthNet, of course, requires this as well through the federal requirement. The division works with MoHealthNet, and Mo Health Net implemented a state aggregator system, maybe aggravating too, but aggregator system where EVV records are compiled and aggregated for all of the personal assistant providers or visits throughout the state. This incentive is for those EVV or those agency personal assistant providers that successfully connect and transfer verified records to the state EVV aggregator. This incentive is not eligible, or self-directed service PA is not eligible for this incentive. And what the incentive is, it's a payment amount equivalent to 1% of the total Medicaid paid PA claim payments made to that agency for a 6-month period. So we'll be looking at July through December and January through June, those EVV records that are verified in the aggregator system to match up with all of the PA claims that are coming from that paid for that provider. This payment is a data reporting payment for VBP benchmarking in future years. Again, this one starts on January 1st of 2023. As I mentioned, there's one payment for July through December and one through January through June. So twice a year, the payment will be made. And why this incentive was put in place. The systems that, the EVV systems, no additional money was given to our PA providers to implement PA or EVV requirements. All of our providers had to go out and get a EVV vendor, and that would connect to the state aggregator system. This is an incentive to get that get on board with that requirement. And in general, EVV records or systems can help with electronic timekeeping. It adds some efficiencies. It can provide quicker payments and allow for better coordination of care. So scheduling verifications as well, and minimizes billing errors. Something else that for our situation as a division, or maybe even as a state, right now, those EVV records are going over to the aggregator, and it's not connected to the claim system yet, but in the future it will be connected to the claim system, and those records will need to be verified before a claim will pay. So it is important that our PA providers get on board and have successful or verified EVV records for each PA visit, so that down the road, when those when the MMIS or claim system is paired up with the EVV system, and it matters that you have an EVV record that is verified so that the claim can be paid. This is important that we get on board now with making sure we have successful EVV records being transmitted to the aggregator. This way, this incentive, if you go down to the how, it's a successful submission of verified EV records for at least 80% of personal assistant services delivered. So we'll do a comparison of the paid PA claims with the state aggregator verified EV records for agency providers, and the provider will have to have at least 80% that are successful for their EVV records. Now, of course, that's where we start with 80%, but you would want 100% as a provider, so that 100% of your claims are paid when they marry up the claim system with the EVV record system. So this is kind of a way to almost see if you're meeting at least the 80%, so that you can prepare and see where you need to make tweaks to make sure you're at 100% when those two systems marry up for paying claims. There are required data points. That's the type of service, individual receiving the service, so your individual, the date of the service, the location, staff providing the service, the time the service ends and begins, and the completion of the memo field with meaningful visit notes. And that's one thing that we wanted to stress as a vision, that it also includes the memo field being completed. So that is a overview of our 9 incentives. I wanted to call attention back to the timeline for our milestones for VBP incentives. You can see that we started as a division in the fiscal year 2019 on the left-hand side of the timeline. And as we move across to the right-hand side, you can see that we're at fiscal year 2023, where we have the General Assemblies passing the budget to include VBP incentives and submission of our waiver amendment for approval by CMS for these payments. So right now in this quarter, we're working to submit that. We'll be then working with CMS for that approval to implement the incentives at the beginning of January of 2023. So we're going to wrap up now with just an overview of where you can send your questions about these VBP incentives. Our division has a mailbox. You can send emails to ddmail@dmh.mo.gov with the subject line VBP. They will be included in a document that we're posting on our VBP website with the questions that we're receiving from our webinars. From last week, we had a provider webinar. This week is our target case management, and then we'll follow up with individuals, families, and guardians on August 8th at 1 p.m. And I know that we're getting I can see that we're getting questions today about our health risk screening tool incentive. Most of them are for that incentive, but we've also received several others in our chat today. So all of those questions will be included in the follow-up document that we will post for question and answers to those questions. And I know you guys, I'm seeing a lot of really good ones that we'll be able to address in that document. So we want to thank you for joining us today. There'll be more information coming out as we move closer to the implementation date and approval by CMS of these incentives. And with that, I think I'll say thank you for joining, and watch the website for the postings for this webinar and the follow-up questions. Thank you.